Dr. Jad, thank you very much for your time and willingness to share your vast knowledge with us here in South Africa. We look forward to learning from you.
Hello, good evening, or I hope all of you are doing well. Thank you so much for the introduction. It's my pleasure and honor to be on board today with you. As we mentioned, today it will be like a short introduction to dental laser, just to let you know, like we will go through the most important points in laser, how to do the applications, laser safety, and just also to let you know about how we are going to do the certified courses in the future. So right now I will start with the first slide, the laser physics. So as most of all of you know, what is laser? Laser is light amplification by stimulated emission radiation. This is the detailed name of the laser, what does laser means. Then I will skip this slide as it is has some unrelated information. So first, if you want to produce a type of energy, you have to have 4 points. First is we have the nucleus, and around the nucleus we have the electrons, and they are moving in the ground state. They are not excited. Then we have an external stimulator, and the stimulator is responsible to stimulate the nucleus. And after the nucleus is being stimulated, we will have the electrons to move from one orbital to another or a higher orbital, which will make the atom to become in the excited state or in the excited mood. So this information is very important because laser is almost or 100% depend on the physics. So to understand what is laser, you have to understand the physics of the laser. So this is the most important point because it will let you know in the future how to understand the tissue reaction with the laser. So as I mentioned, to produce any kind of energy, we have to understand this equation correctly. So we have the nucleus, or we have the atom. Inside the atom, we have a nucleus, and around the nucleus, we have the electrons, which are moving in a normal movement during the ground state. And if we want to produce an energy, then we have to excite this atom or make it in the excited through an external stimulator. So the external stimulator will make the atom in the excited mood, and then after the atom become in the excited mood, we will have the electrons moving in a higher orbital. Then after some time, the electron will come back again to the normal orbital through losing energy. The energy which the electron will lose, it will represent the laser. So in every laser device we have in your clinic or in dental clinic or dermal or whatever the laser device that you have, in every device we have something called the laser production unit, and inside the laser production unit we have 4 main components, or the laser production unit consists of 4 main components. First is the laser source, which will be the atom that we mentioned before. So in the laser source, we can produce laser from a solid material, from a gas, from a liquid, a dye, or a semiconductor. So this is the source of the laser. And it is, of course, it is in the ground state. Then we have something called the stimulating source. And the stimulating source which is responsible to make the laser source or to make the medium to become in the excited mood. We have several options to stimulate our laser source. We can stimulate it through a light source or through a heat source or through an electricity source. Number 3, it will be a 100% reflecting mirror. And number 4, it will be a semi-reflecting mirror, which it will only reflect 70% of the energy and only 30% will come out of it. So in this slide, you can see this is the laser production unit, which is inside your laser device that you will not physically see it unless you have to open the device and see it inside. So in the middle, you can see the laser source or the laser medium, as we mentioned. And the yellow part is called the stimulating source. Usually, most of the dental lasers, they use a light source to stimulate the laser. So in other devices, they use a heat source or an electricity source, but I can say most of the dental or the medical devices, medical laser devices, they use a light stimulating source. Then on the left side, we have a full 100% reflecting mirror. And on the right side, we have a semi-reflecting mirror, which can be around 70%, and sometimes it's up to 85%. What will happen in this inside the laser production unit? So we will have first the stimulating source, or which is light. It will release energy. The energy will make the laser medium or the laser source to become stimulated. The atoms will be excited and they will start to release energy by emitting the photons. And then the photons will be reflected by the 100% reflecting mirror, and then they will pass out, or sorry, they will move out from the semi-reflecting mirror. So in this slide, it will gives you more information about it. So here we have the flash tube in the top, and in the bottom, we have the laser source, the atoms of the laser source, which are in the ground state. Then we have the mirrors 100% on the left side and the partially reflecting mirror on the right side. The light source will release energy. The energy will make the atoms to become excited. They will start to emit photons. The photons will be then reflected by the 100% reflecting mirror, and then they will go out from the semi-reflecting mirror. So the semi-reflecting mirror or the partially reflecting mirror is responsible to filtrate the energy. So all the energy will come out with the same power, with the same frequency. So that's why you can see that the laser is totally different compared to the normal light. This slide, we have the electromagnetic spectrum, and in the electromagnetic spectrum, it shows us what kind of wavelengths that the human eye can see. So every wave or every rays or every energy that we have on the earth, all of them, they have a specific wavelength. So the human eyes can see a wavelength from 400 nanometer up to 700 nanometer. So if we have an energy, or if we have some kind of a light which has a wavelength under 400, simply we will not be able to see it. And if we have another energy which has a wavelength above 700, also simply we will not be able to see it. So our eye can only see from 400 up to 700. So that means that like most of the laser that we see in the market, most of them are invisible, except only few type of lasers which the human eye can see. So we have on the left side, you can see that the gamma rays, X-rays, UV, all of them, we are not be able to see them because they are under 400. And on the right side, you have the infrared, microwaves, radio waves, and all of them are also above 700. So we are not able to see them. Then I will go to the specifications of the laser beam. So the laser beam is a monochromatic, which means it has a one specific wavelength, and this wavelength has a certain color, even if your eye can see that or it doesn't see that. But originally it's a monochromatic, which means it has a specific wavelength and a specific color. It's coherent, which means the laser energy or the laser light is organized. All the photons are moving in the same direction and they are parallel to each other. Then it is directional, which means the laser has a very tight beam, which is very, very strong, and it is concentrated, and all of the photons and all of the energy all of them are parallel to each other. If we compare between the normal light and the laser light, or the normal light beam, you can see that the laser beam is a monochromatic, which means it has a one color, even if you can see it or no. The normal light in your room, it has a different colors and different shades. And you can see that when you turn on the light in your room, you can see that even if the light is white or a little bit like yellowish white, it still have certain and different shades if you give a focus to that. In the laser, it's coherent. It has a parallel waves, but with the normal light, it is not coherent, and it is obviously it is not parallel waves. The laser beam is directional and collimated, but the normal light, it is not directional and it is not also collimated. So if you turn on the light in a specific part of your room, that you will see that the normal light is scattered in the whole area. So it is not only focused on certain parts, but it will be like I can say it will be like scattered in your room. And finally, the laser beam has a very high intensity, but with the normal light, we don't have that. It has a low intensity. So that's why the laser can travel for long distances, and that's why it has like a high energy, which is responsible for all what we mentioned. Then we will go to the most important 5 points, which gives you more idea about how the laser is going to work with your tissue. So first, you have to know the wavelengths of the laser, the power, the application time, operation mode, and the distance between the laser and your tissue. So those are the important 5 points which will let you know how to use the laser. So first, we will go with the wavelengths. The wavelengths is measured by the nanometer, and every energy we have on Earth, all of them, they have a specific wavelength. There are major chromophores which are responsible to absorb the laser energy in the human body. First, it's hemoglobin. Second, the melanin, protein, water, and hydroxyapatite. So I want to clarify one point between the laser and the normal surgical tools that you use or dental instruments that you use in your clinic. So laser is a light, so it works by the absorption. But for example, if you take out a scalpel and you want to cut the tissue with the scalpel, you have to apply pressure on the tissue. So it will cut mechanically by applying pressure to the tissue, and the pressure will cause a tear of the soft tissue or of the hard tissue. But with the laser, even if you push more onto the tissue with your handpiece, nothing is going to happen because it's a light. And with the light, we usually depend on the absorption. So we have 5 main chromophores which are responsible to absorb the laser energy, which are the hemoglobin, melanin, protein, water, and hydroxyapatite. So we have different wavelengths for dental laser, and each wavelength is absorbed by certain chromophore. So not all of the wavelengths, they have the same absorption level, and not all of the wavelengths have the same cutting or the same cutting efficiency on our tissue. So first I will start with the wavelengths of 455, which is the blue laser. So the blue laser is visible. Your eye can see it because it is still in the range between 400 up to 700. I will show to you on the screen. So the blue laser actually is in this range. You can see that it has like medium absorption in the water and also in the hydroxyapatite, but it has a very high absorption into the protein, the hemoglobin, and in the melanin. So mainly the blue laser, it will be focused more to cut on the soft tissue, but on the hard tissue, it will has a less effect because hard tissue are usually consist of water, hydroxyapatite, and less amount of protein. But for the soft tissue, they are mainly consist of protein, melanin, hemoglobin, and like a medium amount of water. So the blue laser, it's actually in this area, and you can see that it has a high absorption into the protein and also melanin, hemoglobin, but low absorption into the water and hydroxyapatite. So that means that the blue laser is going to target the soft tissue. Then we go to the KTB, and this laser is actually green in color. So it has a wavelength of 532. That means that the human eye will be able to see it. It has also a high absorption into the melanin hemoglobin, but it has a less absorption into the protein, water, and hydroxyapatite. So the green laser is usually used mainly for disinfection. So to use it to cut the tissue, you will need to have a high amount of energy or high amount of power to cut the soft tissue. So yes, it is targeting the soft tissue, but mainly it will be better to use it for disinfection and killing the bacteria. Then we will go to the dyed laser, and dyed laser actually they have 4 main wavelengths. First, we will go with the 810. 810, as you can see, it is in this area. It has a very, very low absorption into the water. It has also a very low absorption into the hydroxyapatite. It has good absorption or high absorption into the melanin, and the medium absorption into the hemoglobin and into the water. Then we go to the 940. You can see it has a lower absorption into the melanin compared to the 810, but it has a little bit higher absorption into the hemoglobin compared to the 810, and the absorption into the protein, water, hydroxyapatite is almost, I can say it's almost the same. Then we go to the 980. You can see the 980, it has also a lower absorption into the melanin compared to the 810 and compared to the 940. But it has a higher absorption into the hemoglobin compared to the 940 and compared to the 810. And for the protein, water, and hydroxyapatite, I can say also the absorption level is almost the same. So all of the dyed laser, they are mainly targeting the soft tissue, because you can see that the highest amount of energy absorption all of them are inside the melanin, hemoglobin, and part of the protein. But in the hydroxyapatite and water, we have a less absorption. So the dyed laser is going to target mainly the soft tissue. Then we go to the Indiag. Indiag, it has 1064 nanometer. This is the wavelength. You can see it has a higher absorption into the water, hydroxyapatite, protein compared to the dyed laser. And also it has an almost the same level of the absorption into the melanin and the hemoglobin. So the Indiag is actually can be used for both on the soft tissue to cut it, and it can be also used to cut or to remove some of the hard tissue on the teeth. So you can use it to do scaling, to remove the plaque, calculus. You can also remove the caries. So the Indiag is actually, it is strong enough to do the scaling, to do root planning, and also to remove the caries, but it is not very, very strong to cut the hard tissue. I mean, to cut the enamel and the dentine, you need to have a high power of the Indiag. Then we go to the erbium chromium YSGG. You can see it has a very high absorption into the hydroxyapatite, water, and protein, but it has almost very, very low absorption into the soft tissue. So this laser is mainly going to target the hard tissue. You can use it to cut the dentine, the enamel, you can cut the bone, but of course you have to know, or you have to measure the power correctly to do that function. It has a wavelength of 2780 nanometer. Then we go to the erbium the erbium YAG, and the erbium YAG is almost, I can say it is similar to the erbium chromium YSGG, except that it has a high temperature into the tissue. So when you apply it on the hard tissue, it will generate higher temperature compared to the erbium chromium YSGG. It also have a very high absorption into the water, hydroxyapatite, and protein. So that means that this laser also is going to target the hard tissue. Then we go to the CO2, and the CO2 has two popular or two wavelengths, which is the 10,600 and the 9,600, and it is also have a very high absorption into the hydroxyapatite, water, and protein. So also the CO2 is going to target the hard tissue. So that's like a short introduction to differentiate between the different wavelengths, which is suitable for the dentist at the clinic. So I just want to add one point regarding the hard tissue lasers, which are the erbium chromium YSGG, erbium YAG, and CO2. All of them, of course, they are targeting the hard tissue, but they can also be used on the soft tissue. So we will discuss that in the next slide. So first, here we have the different effects of the wavelengths on the human tissue. So if you are using an incorrect wavelength with an incorrect tissue, we will have a reflection. So there will be no absorption at all because both of the tissue and the wavelengths are incorrect, so the absorption is not going to happen. Then if you are using the correct wavelength with the correct tissue, but with I can say with a very, very low power, so the energy are not enough, cannot be absorbed deeply into the tissue, then we will have a scattered of the energy on the surface of your tissue. And number 3, the absorption, which means we are using the correct wavelength with the correct tissue, and both of them are matching, then you will have a good absorption into your tissue. Even it doesn't matter your tissue is a hard or a soft tissue, but right now we are just discussing about the wavelength and the tissue. Then the last reaction is the transmission. That means that you are using your laser in a very, very high power, which means it will pass through your tissue and it will cause, of course, it will cause some damage. So the most important for the dentist between those 4 reactions is the absorption. If you have a correct absorption into the tissue, you will have a good effect and a good prognosis of your case. Then once the laser is absorbed into your tissue, there are 2 effects which is going to happen. The first one is called the stimulation of the cells. So stimulation of the cells will improve the healing. It will also do disinfection and kill the bacteria, and it will also oxidize any ingredients inside your tissue. And the second effect is the vaporization of the cells, which means it will also kill the bacteria, but it will also cut the tissue. So when the absorption happens, it will depend on the amount of power that you are transmitting into the tissue. If you are using a high power, you will cause a vaporization of the cells and you will cut it. You will cut the tissue. But if you are using a very, very low power, you will the wavelengths or the energy is going to be absorbed by the tissue, but it will not cut. It will only do stimulation to the cells, which will improve the healing and the disinfection. So you can use the diode laser for 2 purposes. The first one is to do surgical application. Second one is to use it for the therapy, or which is called low-level laser therapy. This is a classification or a comparison between the different wavelengths that we have in the market, which are useful for the dentist. So I can say that the soft tissue laser, we have the diode, which is 445 blue laser, and it's visible. The dentist can see it. Then we have the KPT or the green laser. It has a wavelength of 532, and it's also visible. The dentist can see it. Then we go with the diode 808, 940, 970, 980, and 1064 nanometer, and all of them are invisible. So the dentist will not be able to see them in the clinic because all of them are above 700 nanometer. And we have the Indiag. It has 1064 nanometer, India 1340 nanometer, and CO2 of 10,600. So Those are mainly the lasers which are targeting the soft tissue. Then we will go to the hard tissue lasers, which can also be used for soft tissue. So we have the erbium chromium YSGG. It has 2780 nanometer, erbium YAG, CO2, and all of them are mainly targeting the hard tissue, but they can also be used on the soft tissue because these wavelengths have a high absorption into the water, and into the soft tissue, we also have the water into the soft tissue, into the hemoglobin, into the blood. So you will also have an absorption of this wavelength. But the difference between using the diode on the soft tissue or using the erbium chromium or erbium YAG or CO2, that with the diode laser, you will have a less bleeding or almost no bleeding when you use it on soft tissue. But with the erbium chromium, erbium YAG, or CO2, you will have an excessive amount of bleeding because there is no absorption into the hemoglobin. So yes, you will be able to cut the soft tissue, but you will have an excessive amount of bleeding. Then we go to the low-level laser therapy, or the laser which can be used in, for biostimulation. You can use the KPT or the green laser to do biostimulation. You can use the diode 635 and 675 nanometer also for biostimulation. And for the diode 635 and 675, this laser is actually visible. So, and it is red in color. So the dentist can see it because it's still under 700. Then we have the diode 808, 940, 970, 980. All of them also can be used for biostimulation. And finally, we have the helium neon, which has a wavelength of 633. This also can be used for low-level laser therapy. Then we have another type of laser which can be used to detect the caries into the tooth. So we have the diode 504. We have also diode 655. Both of them can be used to detect the caries in your teeth. And finally, we have the last type of lasers, which are called the polymerizing laser or the bleaching lasers. So these lasers are mainly used to condensate the composite when you apply it to make it hard. It can be also used to do a bleaching, and it has a blue color for the argon. So it is also visible. You can see it in your clinic when you do the bleaching or when you are using your light cure. And you have another wavelength of the argon, which is 515. And finally, you have the green laser, which is 532. So this table, it can gives you like a brief differentiation between the different wavelengths that we have in our market. Then right now, I will give more focus to differentiate between the different wavelengths of diode laser. So if we go for the blue laser, which has a 445 nanometer, it has a very high absorption into the melanin and the hemoglobin. The suitable application for it, it will be mainly the soft tissue surgery. It has an advantage of, it has a very high cutting efficiency because it has a high absorption into the melanin and the hemoglobin. So you can use this laser with a very low amount of power, like on 3 watt, 1 watt, or 2 watt, it will be enough to cut the tissue efficiently. But it has a disadvantage of, it has very glowy, and you need to wear a dark glasses to be able to see. And it also have a very high unnecessary cutting efficiency that if, for example, it is only, or it is very good for surgery, but if you want to use it for low-level laser therapy, it will not be the best choice for that. Then we move to the diode 635. It has, I can say it has like a medium absorption into the melanin and the hemoglobin. It is very suitable for the biostimulation. So it is not strong enough to cut the soft tissue, but it's very good for biostimulation. It can be used for low-level laser therapy. Then we go to the 808. It has a very high absorption level into the melanin. It has a good absorption into the hemoglobin, and in the protein, it has a a low absorption, and in the water, it also have a low absorption. Then we go to the suitable application. It can be used for soft tissue surgery. It can be used for biostimulation. The advantage for the 808 that it has an enough absorption level into the soft tissue. So it can give you the benefits of both the cutting and both the biostimulation. Plus that for the 808, it has the ability to improve the collagen production into our body. So it will initiate the collagen production, and the collagen is responsible to tighten your tissue. So that's why the 808 can be used to treat the patient who complain from snoring, because for the patient who complain from snoring, usually if they have a problem in their soft palate, the soft palate will be pulled down by certain factors like the gravity, if the patient is a heavy smoker, or if the patient is an alcoholic patient, or even by the age, the soft palate will have a lower level, so it will go down a little bit. So if you use the 808, it will improve the collagen production, and once you have a collagen available in your soft tissue, it will tighten and it will cause shrinkage of the tissue. Then the soft palate will be pulled up again to the normal position, and the airway of the patient will be opened. So that's why the 808 is suitable for this kind of applications. The disadvantage of it, it has a very low absorption into the water, and if you have a wet tissue or the soft tissue is wet because of the water, you will have a high dispersion of the energy. Then we go to the 940. The 940, it has a high absorption into the protein. It has also good absorption into the hemoglobin, but less absorption into the melanin compared to the 808. It can be used for soft tissue surgery. It can also be used for biostimulation. The advantage of it, that it has high absorption into the protein and hemoglobin, so it is very good for soft tissue surgery. But because the disadvantages of it is you have a high risk to burn the soft tissue because you have a high absorption into the protein. And if you compare the protein and the hemoglobin, in the protein is very sensitive to the heat. So if you have a high temperature of the tissue, the protein will be the first substance to burn out. The disadvantage of it also, it is not as strong as the 808, especially for the low-level laser therapy. Then we go to the 980, and the 980 is one of the most popular dyed laser in the market. It's available since a very long time. It has a very high absorption into the hemoglobin. It has a medium absorption into the water, medium absorption into the melanin, and in the protein, it has a low absorption. It is very suitable for the soft tissue surgery, and it's also suitable for biostimulation. The disadvantage of it is because it has water absorption also, so you have a high risk to increase the temperature of the soft tissue and also to cause tooth hypersensitivity, because our teeth include water and include hydroxyapatite. So if you have an absorption of the 980 into the water, which is available in the dentine on the enamel, and you are using a high power, you will have a high risk maybe to affect the pulp or to cause hypersensitivity of the teeth. Then we will go, in this slide, we have a comparison between the dyed lasers and the IndiAg. We already mentioned that before. So with the dyed, you have higher absorption into the melanin, but in the IndiAg, the absorption is less in the melanin. In the hemoglobin, you have higher absorption for the dyed, but less absorption for the IndiAg. For the protein, I can say that it is almost the same, but for the hydroxyapatite and the water, the IndiAg is absorbed much more compared to the dyed. The suitable application for the dyed laser are mainly the soft tissue surgery, biostimulation or low-level laser therapy, and finally the anti-snoring therapy, which can be used by the 808 nanometer. The suitable application for the IndiAg are soft tissue surgery, root planning, scaling, caries removal, because it has it has a good absorption level into the hydroxyapatite and in the water, so it is still have the ability to cut the hard tissue. Of course, it is not strong enough as the erbium YAG or the erbium chromium or the CO2, but still it can do a good job for that. Then we go to the advantage. So the advantage of the diode laser, it has a higher soft tissue cutting efficiency, and it has a better thermal control compared to the IndiYAG. The advantage of the IndiYAG are it has a good soft tissue cutting efficiency, but the diode is much more better for that, and it is very suitable for disinfection and root canal treatment support. The disadvantage of the diode is, like, I can say that the IndiYAG is better for the disinfection, and diode is not suitable for root planning or scaling. It doesn't have the ability to do that. But the IndiYAG, it has the ability to do root planning. It has a better ability for disinfection. And IndiYAG also can be used to treat snoring, but it has to be like mixed together with the erbium YAG. So if you use IndiYAG and erbium YAG for some devices, they have a mix between the erbium YAG and IndiYAG. And in these devices, you can also use it to treat complaint from snoring. So the IndiYAG itself alone is not strong enough to treat the snoring, but the diode laser 808 is better for that part. Then in this slide, we will have also a comparison between the hard tissue lasers which are available in the market. So we have the erbium chromium YHGG. It has a higher absorption into the water, high absorption into hydroxyapatite, and I can say medium or low absorption into the protein. It is very suitable for hard tissue applications, and also it is suitable for soft tissue application, but you will have bleeding because of the absorption into the hemoglobin is very low. So you will cut the soft tissue, but you will have excessive bleeding. The advantage of it is very good to cut the hard tissue, and it has a better thermal control compared to the erbium YAG. Disadvantage of that is erbium chromium is not erbium chromium, but most of the hard tissue lasers are not fast enough if you compare them to the regular turbine that you use in your clinic. So still, the turbine is still a little bit faster than the erbium chromium and the erbium YAG if we are going to speak about cutting the hard tissue or cutting the enamel or the dentine. Then we go to the erbium YAG. Erbium YAG has a higher absorption into the water compared to the erbium chromium, and also higher absorption into the hydroxyapatite, and the protein absorption is almost the same. It is also suitable for hard tissue application. It can do soft tissue application, but also you will have excessive bleeding because the absorption into the hemoglobin is almost zero. It has better hard tissue cutting efficiency compared to the erbium chromium because it has higher absorption into the hydroxyapatite and the water, so it will cut better compared to the erbium chromium. It can be used in combination with the IndiYAG to treat the patient who complain from snoring. Then finally, the disadvantages are it is not very strong also compared to the turbine handpiece, which used in the clinic to cut the hard tissue. And it has a higher tissue temperature if you compare it with the erbium chromium. Finally, we will go to the CO2, and the CO2 have three main wavelengths. It has the highest absorption level into the hydroxyapatite and water and protein. So it has higher absorption in those compared with the erbium YAG and erbium chromium. It can be used for hard tissue applications, soft tissue applications also, but of course you will have also bleeding with it. The advantage of it is it is very powerful, high cutting speed on both hard tissue and soft tissue. So this laser is actually very strong, very fast to cut both of the hard tissue and soft tissue. The disadvantage, it is somehow these devices are a little bit expensive in the price, and they require high skill of the dentist. So if the dentist doesn't understand correctly the interactions and the physics of the laser, they will not be able to use this device correctly. Then in this slide, I'll go through it shortly. So here you have on the left, we have the laser type, the wavelength, and the penetration depth into the tissue, and the source of this laser, operation mode and delivery system, and the main absorbent that can absorb this laser. So we have the CO2, it has a penetration depth into the tissue of 0.01 millimeter. The source of this laser is a gas. It can be used in both continuous wave and pulsed wave. The delivery system can be delivered in a waveguide, handpiece, or in articulated arm. The main absorbent of this wavelength is the water and the hydroxyapatite. Then I will skip the helium and the argon. I will go to the indiag, erbium, and erbium chromium, and erbium YAG. You can see that the indiag, it has a penetration depth of from 2 millimeter up to 6 millimeter into the tissue. The laser source is a solid medium. It can be used in continuous wave and in a pulsed wave. The delivery system will be an optical fiber, and the major absorbent is the melanin, water, and hydroxyapatite, or the dentine. Then we go to the erbium chromium, YSGG, erbium, and erbium YAG. Both of them, they have a penetration depth into the tissue of 0.01 millimeter. The laser source is a solid medium. It can be used in a pulsed operation mode. And erbium chromium YSGG can be delivered through an optical fiber, but erbium YAG can be delivered in an optical fiber, waveguide, or an articulated arm. Both of them are mainly absorbed by the water and hydroxyapatite. Then finally, I will go to the diode. We have, as we mentioned, we have different diode, different wavelengths of the diode. So I will speak about the 980. The 980 has a penetration depth into the soft tissue from 2.8 up to 4 millimeter. The laser source is a semiconductor. It can be used in both continuous wave and a pulsed wave, and the delivery system is an optical fiber, and the major absorbent is the hemoglobin and the melanin. If we go to the diode 808, it has an absorption level into or a penetration depth, which is 1.3 up to 2 millimeter penetration. It is also a semiconductor laser source. It can be used in both continuous wave and a pulsed wave, and the delivery system also is an optical fiber. On this table, we have a small comparison between the laser and the conventional treatment. So with the laser, we have a less anesthesia injection. Laser is faster to be absorbed and is less painful compared to the conventional treatment. With the laser, you can use a topical anesthesia, a spray anesthesia. So in most of the cases, you will not need to do a nerve block. Of course, some cases you have to do a nerve block, but most of the cases you will use less injection. So the suitable anesthesia to be used with the diode laser, I can say that plain anesthesia will be suitable for that, because the plain anesthesia doesn't have epinephrine or doesn't have an adrenaline, so it will not cause contraction of the vessels. So you can use a plain anesthesia, because with the diode laser depends on the absorption by the hemoglobin. So if you inject the normal anesthesia, which has an adrenaline or epinephrine, that will cause the hemoglobin to escape from the application area. So the best type of anesthesia to be used with the diode laser, it will be the plain anesthesia without epinephrine or without vasoconstrictors. With the diode, as I mentioned, you have infiltration injection. You can use gel or spray, it can be enough. And it's also less invasive if you compare it with the conventional treatment. But with the conventional treatment, injecting anesthesia is always required. In some cases, the plain anesthesia is not recommended for some treatment. So you still have some limitation compared with the laser. With the laser, you have less bleeding when you use the diode, and also in some cases, or most of the cases, you don't need to do any sutures or stitching. You have a clean and a well-defined cut. The application area is totally clear, and it has an enhanced vision for the dentist, so the dentist can be able to see what he is doing. You have a faster recovery and a healing, which can happen approximately between 3 days up to 8 days. If you compare it with the conventional method, the bleeding is always is something usual. It's most of the time it's available in the very extensive surgery. You will have to do sutures and stitching. The application area is affected by the bleeding, so the dentist is not be able to see what he's doing. The recovery and the healing, of course, is much more longer. With the diode laser, you can do disinfection and decontamination of the area. You can also disinfect and decontaminate the pocket and the root canals. But with the conventional treatment, you have to use disinfecting liquids to do that. With the laser, you have less bacteria available in the application area, but with the conventional treatment, bacteria is always available in the application area. The laser has shorter treatment time compared with the conventional treatment, which has a long treatment time. The laser can be used both for the pregnant women and the children, but with the conventional treatment, it is sometimes you have some limitation with the pregnant woman or with the children. Laser has a less post-operative complication and less post-operative discomfort. Plus, it also, in some cases, you don't need to use any post-operative medications. But with the conventional treatment, most of the time, the patient will complain from discomfort, complication, and sometimes also you need to give the patient some medications after the treatment. So this is like a small differentiation to explain the difference between the laser and the conventional treatment, which you can also tell to your patients, because some patients, they are not willing to pay extra money for the laser. So as a dentist, you have to explain to the patient why the laser is better than the conventional method. And through that table, you will be able to convince the patient to pay more for your treatment. Then we will go to point number 2, which is the power. So we were discussing in the last slides, we were only discussing the wavelength. So today so right now we will discuss point 2, which is the power. The power is measured by the watt, and the power is actually responsible for the cutting efficiency of your laser. So if you have high power means that you will deliver more energy, and the energy will be absorbed by the tissue, and more energy means more cutting. So laser actually cuts through the heat. So this energy will increase the temperature of the tissue, and then it will be able to cut. So when you have high power, you will have both high energy delivery and also high temperature of the tissue. Anyway, I can say that the dentist should always use the lowest power as possible. So it is not always very good to use high power to cut more. So if for example, for the soft tissue, you can cut it with a continuous wave, you can cut it with 2.5 watts. So if it is not necessary to use 7 watt or 10 watt, or so I can say if 1 watt is enough, then just go with 1 watt. You don't need to increase the power because actually it will not be very beneficial, and it will also affect the prognosis of the treatment. So always try to use the lowest power, which is enough to cut your soft tissue. How to know that? You can just make a small test on the soft tissue or on the hard tissue using a very, very low power, and you can see the tissue reaction. So if you can find, like, for example, if you use 1 watt on a soft tissue and you find that the tissue reaction is very suitable for you and is correct, then okay, you can stick with the 1 watt. You don't need to increase the power. So always before starting any laser treatment on any patient, you can just make a very small test on the hard tissue or on the soft tissue, depending on your device. and you can see, and you can use a low power. If the low power is enough, then you don't need to increase the power for unnecessary reasons. As every patient is different and they have different level of chromophores in their soft tissue or in their hard tissue. So that's why you need to make a small test before starting your treatment. For example, you have the diode laser. Diode laser is absorbed more by the darker surface compared with the light surface. So if you have a dark gingiva, if your patient have a dark gingiva, then it is advised to decrease the power because you will have higher absorption and you will may damage the tissue if you use high power. Because darker gingiva has more melanin in high level of melanin. So that means you will have also higher level of absorption. So in that case, increasing the power will cause the energy to be absorbed more, and it will increase also the temperature of the tissue, and then at the end, you may cause some damage of the tissue. So if you are using the diode laser and you have a darker gingiva or a dark surface, always make sure that you are using the lowest amount of power as possible. Then point number 3, it's called the application time. And for the application time, actually, it is measured by the seconds. Longer application times means that you will have more absorption by the tissue and of course, more effect. As I mentioned before, laser is not a mechanical tool. It is not a scalpel. It is not a surgical or a surgical knife. It is totally different. With the laser, we cut by the absorption. So the energy has to be absorbed by your tissue. Either the tissue is soft or hard, it doesn't matter, but you need to have a correct or enough absorption so you can cut the tissue. So if you apply more pressure with the handpiece onto the tissue, you will have no effect at all because laser doesn't cut by pressure. It is not a mechanical instrument. But with the scalpel, of course, if you do more pressure on the tissue, you will cut more. So how to measure the application time? I suggest that you have to do more practice and try to use the diode laser like on a chicken breast or a liver, so you can understand the absorption in both the hemoglobin and both in the melanin. So every patient have a different tissue interaction with the laser. So at any time you have to work slowly. You don't need to work very fast, because if you work very fast, you will not give enough time for the tissue to absorb the energy, and at the end, you will not receive a correct effect. So usually, you try to work as slow as possible to give enough time for the tissue to absorb the laser energy, and then you will be able to have a better effect. Every tissue has different levels of the chromophores, which we mentioned before: hemoglobin, melanin, hydroxyapatite, and water. So if you have high level of chromophores inside the tissue, you will have higher absorption, and in that case, you don't need to use high power. And tissues which has less level of chromophores, they will have less absorption level, and of course, in that case, you need to increase the power so you can deliver more energy into the tissue. In this picture, you can see on the left side, the application was slower, and you can see that the cut is more deeper and it has better incision lines. If you compare it with the picture, with the cut, sorry, if you compare it with the cut on the right side, you can see that that cut it is a little bit shallow and superficial, because on the left side, we used slow cutting, and we give enough time, slow application time, so the handpiece would move slowly, so the tissue was able to absorb the energy, and then you will be able to have a deeper cut into your soft tissue. But on the left side, on the right side, the application time was very fast. The dentist moved faster, so at the end, you had a superficial level and a shallow incision. Point number 4 is the operation mode, and we have 3 main operation modes for the laser. We have the continuous wave, we have the gated mode, and we have the pulsed mode. With the continuous wave, we have a continuous stream of radiation. So the energy are coming out continuously without any interruption. So that means that the laser is not going to be interrupted at all. It's coming out as flowing as like a water stream. The advantage of the continuous wave, it has a high power output and it has a rapid cutting, but it has a disadvantage that you have high risk to damage the surrounding tissue because you have high temperature, high increase in the tissue temperature. Then we go to the gated mode. The gated mode is actually similar to the continuous wave, except that the laser beam is interrupted at regular intervals by a mechanical gate. So once the mechanical gate is closed, the laser is not going to come out. And when the gate is open, the laser is going to go out. So when the gate is open, you will have the laser on. And when the gate is closed, you will have the laser off. It has an advantage that it can give you better thermal control compared with the continuous wave, because when the laser is on, you will increase the temperature of the tissue, and when the laser is off, you will have no laser at all, and this will give enough time for the tissue to cool down. So with the gated mode, you have a better thermal control, and also you have a good cutting efficiency compared with the continuous wave. Then we go with the pulsed wave. So the pulsed wave is, I can say it is similar to the continuous, it's similar to the gated mode, except that the laser beam itself is interrupted at regular intervals through an electronic channel. So the pulsed mode itself has the ability for the on and off laser time. So in this part, we don't have a mechanical gate to do this function, but the laser beam itself has this ability to do that. It has an advantage. It has a better thermal control. It gives you enough time for the tissue to cool down, because when you have between the two pulses, if you have a high pulse and in the low pulse, between those pulses, you will have like a short time for the tissue to cool down. With the pulsed mode, it allows us to use a very high amount of energy or high power. So you can use 15 watt or 16 watt or even up to 150 watt. You can use the pulsed mode with that without causing without causing some damage to your tissue. In this picture, it can show you the difference between the continuous mode and the pulsed mode. You can see on the continuous wave, we have a high thermal damage to the surrounding tissue because the laser is coming out continuously without any interruption, which will increase the temperature of the tissue. And in the pulsed wave, you have less thermal damage to the surrounding tissue because you will have the laser on and laser off. And at the laser off time, you will have no laser at all, and this will give enough time for the tissue to cool down. Then finally, point number 5 is the distance between the laser handpiece and the tissue. Of course, if you are very close to your tissue, you will have more absorption and more effect. And if you are far from the tissue, you will have less absorption and less effect. Some applications, it require you to be in contact with the tissue, but just a contact, not without pressure. So you only have to be slightly moved on the tissue, but without doing any pressure. So you have to move slowly in order to give enough time for the tissue to absorb the laser energy. Other application, it is not necessary to be in contact with the tissue. So in these applications, you can use your handpiece to be away around 5 up to 20 millimeters away from the soft tissue or from the hard tissue. This is the heat generation related to the distance. So as I mentioned, if you are very close to your tissue, you will have more energy absorption. And if you are very far, you will have less energy absorption, and you will also have less area of coverage in the application. And this slide, it shows you the temperature and the time that will cause that the laser is going to increase the temperature of the tissue. So you can see that if we have a continuous laser application until 10 seconds, you can see that we will reach a temperature level up to 55 Celsius, and until 55 or until 60, you will have like an irreversible tissue change. So if the temperature of the tissue is increased more than 60 Celsius, in that part you will start to cause a serious damage to the tissue. So that's why when you use the laser, try not to use a very long application time. So try not to work very fast and not to work very slow. So you have to be in an adequate certain time, which is enough for the application. Here are the heat effect on the tissue. If we have a temperature increase from 37 up to 60, you will see no optical change and you will see no mechanical change into the soft tissue. If the temperature is more than 60 Celsius, you will start to see a coagulation of the blood. You will start to see a white grayish color in the application area. And finally, your tissue will lose up and break up and to be teared. If the temperature is less than 100 Celsius or almost 100 Celsius, you will have a dehydration of the tissue, coagulation, and you will start to see the brownish black color or a light black color to start to appear. You will have a loss of water. The tissue will have high shrinking. Then if the temperature is increased up more than 100, then you will have carbonization and vaporization. You will start to see smoke coming out from the soft tissue. You will have a dark brown or a black, and once the laser is touching, once the handpiece is touching the tissue, you will burn the tissue immediately because you are using an extra unnecessary energy. And the energy, when you have more energy, you will have more increase in the temperature. In this slide, you can see that we have two zones which will appear when you apply the laser on the soft tissue. So the first area of contact with the laser beam, we can call it the ablation zone, which means that you have a direct contact with the laser beam. And in this area, the laser will start to cut immediately. And then we have a heat affected zone, or we can say the coagulation zone. And this area is actually under the ablation zone. This area will be affected by the laser energy. And in this area, we will start to have biostimulation of the cells. So that's why when you cut with the laser, you will have less complications after the treatment. The patient is not going to, mostly is not going to complain from discomfort, because even when the laser is cutting, it is also biostimulating the cells, and it is killing the bacteria, and it is improving the healing in the future. So that's why the laser is better compared with the conventional methods. I will skip, I will go very fast in these slides. So if we have a temperature increase between 37 up to 60 Celsius, in here we will have a warm up of the tissue, and the parameters are low power. The application time is very short, and the distance between the handpiece and the soft tissue is very far. Here we will have only a warm up, and usually this is the effect that you will have in the low level laser therapy or in the biostimulation therapy. Then if the temperature is increased from 60 up to 65, we will have a denaturation of the protein. You will start to see the white or the grayish white color onto the tissue, and then the tissue will start to tear up, and you will have a denaturation of protein. The parameters was also low, but not very low, but I can say medium parameters. The application time was also a medium radiation time, and the distance between the handpiece or between the laser source and the tissue was much more closer compared to the last slide. Then in this slide, we have increased the power. We have increased the radiation or the application time. and we had a contact application. So the laser beam was in contact with the tissue. In this slide, you can see that we have a high vaporization, desiccation, and denaturation of the protein. You will have an immediate shrinkage of the soft tissue, and once the laser touch the soft tissue, it will cut immediately because we have a very high power and also we have a longer application time. In this slide, the power was increased more and more. The radiation time also is, I can say it's a long radiation time. We have a contact application, so the laser beam is in contact with the tissue. You can see that the temperature have reached up to 150 Celsius. You have a carbonization, you have the smoke, you have a black color. In this kind of treatment, of course, the prognosis is not going to be very good because you will cause a serious damage to the tissue. Finally, the temperature was here in this slide, it was less than 300, and also you will, once the laser touch the tissue, it will burn it immediately because you are using a very, very high power, which are unnecessary. So my point is, try as much as you can to use the lowest power as you can. So it is not always very good to use high power, and it's also unnecessary. Now we will go with the low-level laser therapy or the photobiomodulation. So what is the low-level laser therapy? It means that the laser energy will be delivered to the soft tissue with a very, very, very low amount of power. So in this part, we don't need to cut the tissue, but we only need to stimulate the soft tissue, and when the soft tissue is stimulated, this will improve the energy. Then we go for the low-level laser therapy. In the low-level laser therapy, we have we have around 6 tissue interactions which are going to happen. First, we will have a microcirculation, improved or increased microcirculation in the tissue. We have a photoactivation of the inactive enzymes which are available in the painful cells. We have an improved cellular function because we will increase the production of the ATP, and when you have high amount of ATP, that means you will have better healing, because the ATP is the energy the energy currency into our cells, and when you have more ATP, that means you have more energy for the cells to do the vital process. You will have you will have faster healing, more blood circulation, and that will cause, it will reduce the edema, it will reduce the pain into the application area. Plus, you will increase the collagen production. Another point is when you have more collagen into your tissue, you will have better tightening of the tissue and the better, like, for example, if you are going to speak about the patient who complained from snore, when you apply the collagen will tighten the soft tissue, and then you will have a better treatment to treat the patient who complained from snore. So this is actually what happened in the low-level laser therapy. I will try to explain it more. So we have the mitochondria inside our cells. The mitochondria is responsible to produce energy and nutrition for the other cells to do the vital process. Inside the mitochondria, we have something called the nitric oxide, and when the nitric oxide level is increased or decreased, it will cause some problems in the cell metabolism and also in the mitochondria function. So when we have higher level of nitric oxide, the mitochondria, the cells, will not be able to do their vital function correctly. When the laser is absorbed by the cells, it will break down the nitric oxide, and the nitric oxide level will become to the normal. And when it becomes to the normal, you will have more production of the ATP, more production of the nutrition. And of course, the cells will have more energy to do their vital process. So that's like a short or a brief information about what happened when the laser, when the low-level laser is absorbed by our cells. You can use the low-level laser therapy to do several applications, such as relieving the muscle pain, relieve the pain from the muscle, use it to also to treat the patient who complain from TMJ pains. But first, you have to know that the low-level laser therapy will only treat the symptoms. It will not treat the reason. So if you have a patient who complain from, who has a pain from clicking, you have first to treat the reason of the clicking and then use the low-level laser therapy to decrease the pain. So low-level laser therapy or biomodulation is not enough to treat the reason, but it will be very beneficial to treat or to remove the symptoms. Now we will speak about the laser safety. So I will go through it very fast, as I know we have more. We don't have enough time. We already passed 1 hour. So we have different classifications of laser. We have a class 1, class 2, class 3, and class 4. So I will speak mainly about class 4. So class 4 is mainly the most important for the dentist or for the doctor. Lasers are absorbed by the human tissue and can be absorbed by our eyes, by our soft tissue. So when you are dealing with any when you are using any class 4 laser device, you have to protect yourself as much as you can, and you have to take all the necessary precautions for that. Here are the laser safety rules. First, the dentist, dental assistant, and the dental nurse, and of course the patient, all of them, they have to wear the specific eyeglasses or the required protective eyeglasses during the laser treatment. The clinic should be totally closed. Nobody should enter during the laser treatment to avoid any unnecessary harm or damage. Always try to use the suitable safety glasses according to the laser type that you are using. So not any protective glass is suitable for every wavelength. So first you need to know which kind of wavelengths do you have, and then you will be able to choose the correct protection glasses. Try to change the safety glasses every 6 months if you are a heavy user, and if you are because every time you use the laser, the safety glasses, it has a filter on it, and every time you have a reflected energy toward your glasses, you will have the filter to become more and more affected. And by the time some of the filter on your glasses will be affected, and maybe you will have some energy to pass through. So try to change the safety glasses every 6 months or maximum every year. It will be better to change your glasses. You have to put the laser warning sign, of course, outside the clinic. Try to use an instrument which doesn't have a reflective surface. So for example, you can use a plastic instrument, a wooden instrument, because when you use the metal instruments, you will have more chance to reflect the energy towards your eye or towards your dental assistant eyes. So in case you are not able to have a plastic or wooden instrument, then try to make sure that the laser beam doesn't come in a direct contact with the metal instruments. Try to use a high suction and also a correct face and mouth mask to protect yourself from the laser blooms, as laser blooms are also some kind of, I can say it is something looks like the smoke, but you don't really see them by your eyes. But the laser blooms has, sometimes they have bacteria, sometimes they have viruses. So it is always better to use the correct face mask and also the correct high suction into the patient mouth, so you can make sure to avoid any unnecessary laser blooms to come out into your face. As we mentioned before, try to use the minimum power for the application, so it is not always necessary to use high power. Then always try to avoid using any gas or any aromatic or alcohol swabs during the application because with the high energy of the laser, you may cause some flames to come out from the alcoholic swabs. So you need first to stop the laser and then use the swab. Another point is regarding the cooling. If you are using diode laser, when you are applying the laser on the tissue, don't use the water at the same time with the diode laser, because the water will decrease the absorption level of the diode. So first you stop the laser and you apply a few drops of water to cool down the tissue, and then you start your laser again. So don't mix both of them at the same time. Here we will speak about the protective eye equipment. So each eye glasses or each protection glasses, it has different markings on it. So it will show you the wavelengths that these glasses is suitable for. It will also tell you about where the filter is applied on your glass. It is a full coverage filter or partially covered. It will also tell you the protection level of this filter, which kind or how long these glasses is going to last against the reflected energy. You can see this is the glasses. The main important three markings are: first is the wavelengths, second is the operating mode, which kind of operating mode you can use these glasses for. Is it continuous or pulsed or both? Then you have the protection level, and when the protection level, it will tell you if the protection filter is on the whole glasses or it is on certain parts, and how long the filter is going to last. So that's why I was telling that it will be better to change your glasses every 6 months or every 1 year maximum. In this slide, I will also skip it. It will show you the laser wavelengths and which kind of which area of the eye is going to be affected when you use these wavelengths. So, and which where exactly the damage is going to happen. So anyway, the best for us is to wear the glasses at any time. Once the laser is activated, every person who is inside the clinic or inside the training, all of them, they have to wear the glasses at any time. Then I will go to something called the laser bloom. So the laser bloom is something like a smoke which will come out from the laser vaporization which happen into the cells. Mainly the CO2 laser is one of the lasers which produce a very high amount of laser blooms compared with the diode. So with the diode, we have a very, very less blooms compared with the CO2 or with the erbium YAG or erbium chromium. So usually the laser plume as something like a smoke. It will include, sometimes it will include some dust, some blood fragments, some bacteria, maybe sometimes some viruses. So it is better to use the correct or the suitable face mask to protect yourself from the laser bloom. This is the laser bloom. Actually, you can see it. It is here. It is magnified, but actually in the clinic you will not be able to see the laser bloom. So because it's something very, very small, and we will not be able to recognize it. So the best method to protect yourself from it is you can wear a suitable face mask which is designed against the laser blooms. You have to wear your glasses, and if possible, you can also wear a plastic face shield in case if you are using CO2 lasers. But with the diode, I can say with the diode is different because the laser blooms from the diode is a little bit very, they are very low in amount compared with the CO2. Then we go to the protective methods that we have, or the protective equipments that we can use during laser treatment. First, we have to use a special bloom protective mask. So there are certain masks that should be used with the laser treatment. So not every surgical mask is not also suitable for this kind of application. There are certain masks which can be used with the laser applications. It should have these marks which are on the screen. So I will send you this presentation so you can also have more idea about which kind of face mask that you should have and which kind of markings which are available on the face mask that you should get. Then another thing regarding the coronavirus together with the laser, because right now laser is one of the best options to be used with the patients who complain or who have coronavirus, because with the laser you have less amount of bleeding. Another point, you have less risk of transmission of the virus to the dentist, because if you use the conventional method, with the conventional method, always you will have to use the suction, you will have to use the water cooling, and then you will have a high risk of transmitting some of the saliva or some of the infectious materials to the dentist or the dental assistant. So there was some researches, as mentioned on the screen, that you can use the povidone iodine during the laser application. You apply it onto the tissue, and this also will it will decrease the risk of infection to the dentist and also to the dental assistant. So with the povidone iodine, you can use it together with the diode laser. You stop the application and then you apply small drops onto on the tissue, and then you continue the application again. So this way can help you to prevent some of the risk in the high infection risks in the clinic. You can also use an extraoral suction or a HEPA filter in your clinic. So these kind of devices will help you to reduce the infection risk at your clinic from the patient to the dental assistant or to the dentist. Then I will speak about the laser devices that we have in our market. So we have two main types of laser devices in the market. We have the open mode devices and the preset mode devices. So with the open mode, you can control different parameters of your device. You can control the power, the frequency, the pulse duration, and also the pulse intervals. So the open mode devices, they come with the ability to control these parameters, plus it also comes with the preset parameters inside the device. If we speak about the preset mode devices, these devices comes with the preset parameters. So the dentist is not be able to change the parameters, but he will be like limited to use the applications which are preset by the laser manufacturer. So what is the advantage of both of them? So with the open mode, you have more flexibility, especially for the laser specialists and the researchers who are doing some research and who want to know exactly how much amount of the power is coming out and which kind of bacteria or viruses were affected. So the open mode devices will give you more flexibility if you are very specialized in laser and if you are doing some researches. For the preset mode devices, they have an advantage because they are very easy to use, fast to use. You just like plug and play. You will just choose the application and start. Sorry, you will just use the program and start the application. For the open mode devices, the dentist should know how to measure the parameters correctly. He should know the laser physics and also the tissue interaction with the laser in order not to cause any damage to the patient. Because if he simply doesn't know how much power, how much frequency, how much is the pulse duration, he simply is going to cause some damage to the patient. The preset modes is not suitable for the laser specialist because most of the laser specialists, they want to modify the parameters. So if they cannot modify the parameters, it will not be very beneficial for them. For example, we have different devices in the market which are open mode or a preset mode. You can find them in this table also. So this is like a short introduction and to differentiate between the preset devices and the open mode devices. Then we will speak about the laser delivery system. You can deliver the laser from the laser production unit to the patient mouth through 4 main ways. First, we have the articulated arms. Second is the waveguide. Third is the handheld units. And finally, the optical fibers. So the articulated arm, as you can see, this is an example of the articulated arm on the screen. So articulated arm is mainly used for the erbium YAG, erbium chromium, and CO2 lasers. So they are the main use for that because they have a high energy transmission. It can transmit more energy, but it has like a disadvantage because it is very limited into the movement. So sometimes it is not sometimes it's not very suitable in the movement to the patient mouth. Then we go to the waveguide. This is also an example of the waveguide delivery system. It is somehow similar to the articulated arm, but it gives you more flexibility and more movement to the patient mouth. Then we go to the handheld units, and these units are actually very weak, and by the time they will be damaged because they are not very strong enough, and they also have a very, very limited dental applications. Like you can use them for certain applications, not very, if you want to do like an invasive surgery, I will not recommend this device to be used. Finally, we go with the optical fibers, and with the optical fibers, they have an advantage because they are very flexible, so they have the ability to transfer more energy to the patient's mouth, and also it gives you better movability and accessibility into the patient's mouth. And finally, we will go with the optical fiber. Diode laser usually use optical fibers to cut the tissue. All of the fibers that you will receive with your device, they will be non-initiated. So the fibers has there are 2 types of fiber. First one is the non-initiated fiber and an initiated fiber. So the non-initiated fibers means that the laser is not going, the fiber is not going to cut the tissue, but it will disinfect and kill the bacteria and also coagulate the blood. The initiated fibers means that the fiber is going to cut your tissue. So that's the difference between using a non-initiated fiber and an initiated fiber. So how to initiate the fiber? You bring the fiber and apply it on a very, very dark surface. I would recommend the eye mascara because this is one of the very useful materials that you can use to initiate your fiber. You apply the laser for 5 or 6 seconds, not continuously. So you apply it interruptedly until the end of the fiber become black. That means that your fiber is initiated and is able to cut. After you do that, you can also check on a dark paper, and you can see that the laser beam is coming out in a pointed laser beam, not scattered. So this is also another way to know if you have done the initiation correctly or no. Then we have another point is cutting the optical fibers. So most of the diode laser fibers, they need to be cut after the treatment. So cutting the fiber is a very sensitive procedure. So the dentist has to make sure that he has cut the fiber correctly. And after he cut the fiber, he has to do something called the cleavage. So he makes sure that the laser is coming out in a point, not scattered. To cut the fibers, usually we use a ceramic cutter, because the ceramic cutters, they have the ability to cut the fibers correctly without causing any problems. It is not recommended to use a normal metal cutter or something. So you have to use the specific fiber cutters, which is recommended by your laser manufacturer or by your laser device. Usually the optical fiber cutter should be changed after 1 year, because by the time the cutting efficiency of the cutter will become low. So it is recommended to change it every 1 year. In this picture, you can see the difference between the correct cutting. Here you can see at the last point of the fiber should be almost have like a 90-degree or a flat ending. In this picture, you can see there is this is the incorrect cutting way. You can see that the laser is cutting through an angle. So if you have an angle or if you have an irregular cut, that will not give you a correct delivery of the energy to the patient mouth. And of course, it will affect the cutting. And at the end, it will also not give you a well-defined cut. So usually, to make sure that you have done the cutting correctly, bring a black paper or any dark surface, and then you bring your laser, and you have to see this circle. It should be a uniform circle of laser. If you have these shapes in this slide, that means that your cutting is not correct. And having an incorrect cutting, that means that you will not have a good cutting efficiency and a good delivery of energy to the patient or to the soft or the hard tissue. So with this way, you have to make sure that you have cut the fibers correctly and that the ending of the fiber is totally or almost flat. We have different types of diode laser optical fibers. There are fibers which can be used single-use fibers, multiple-use optical fibers which are autoclavable, or optical fiber wire, which is also single-used. And finally, we have something called the glass rod. So these are the single-used optical fibers. They have an advantage of they have less risk of cross-infection. They are easy to use, but the problem for them, they are expensive in the price. And sometimes some dentists will try to autoclave them or sterilize them, but this is not recommended, because when sterilizing these kind of fibers, they will become damaged and brittle. And when you use them on the patient mouth, they will simply break and they will not transfer the correct energy. So you have to use these fibers only one time as recommended by the laser manufacturer. Then we have the multiple used optical fibers. They are autoclavable. One fiber can last up to 45 patients. They have different sizes, and these kind of fibers are already cleaved by the manufacturer, so you don't need to cut them. So they are already coming out from the manufacturer cleaved, and they have certain serrations into the fiber, so the fiber itself will break from the nearest serration, and these serrations are also cleaved. So the dentist doesn't need to cut these fibers or use an optical, use a fiber cutter with this one. The advantage of these fibers, as I mentioned, they can last up to 45 patients. They are autoclavable, they are multiple used, so they will save a lot of money for the dentist if he uses these kind of fibers. Then we have the optical fiber wire, and these fibers are actually comes into a wire, and you take out the certain length that you want, and you cut it, and then you connect it to the handpiece. It has an advantage because it's very cheap. It is not costly, but the problem for this one, it cannot be sterilized. It always needs to be cut and cleaved carefully, because it is always bending. And another point is it is limited in size, so you cannot find different diameters of these kind of optical fibers. finally, we have something called the glass rod, and the glass rod are mainly used for low-level laser therapy and to treat the hypersensitivity of the tooth and also to do bleaching. So these kind of handpiece, they will not have the ability to cut, but they will only deliver a low amount of energy to the tissue to cause biostimulation or biophotomodulation. Then finally, I just want to add one point regarding the diameters of the fibers. The smaller diameters will have higher cutting efficiency compared to the big diameters. So for example, if you have a 200 micrometer fiber, it will have a better cutting efficiency compared to the 600 micrometer fiber, because the laser will become more pointed, and more pointed diameters means it will cut more. But with the 600, you will have a less condensation of the laser beam, so you will have less cutting efficiency. So this is just for your knowledge. It is something, for example, it is similar to the X-ray that you use in your clinic. So X-rays with a small focal spot, they will have better penetration into the tissue compared to the X-rays which have higher focal spots. I will go right now through the clinical applications. So I just need to mention one thing regarding Alexian lasers. So as we spoke earlier in the first slides about the laser production units. So as I mentioned already, that that most of the companies or the diode laser companies, they are using an external stimulator to stimulate the laser medium. Mostly they are using a halogen lamp, but for Alexion, we are currently using an LED flash lamp. So the LED flash lamp has a better ability to reach the maximum power in a very, very short time. And also, if you compare to the LED lamps and the halogen lamps turn on slowly to reach the maximum power, and they turn off also slowly. So if you are using the gated mode or the pulsed mode, between the two pulses, or between the off time and the on time, you will still have the laser available. But if you are, with Alexian laser, they are using an LED flash lamp. So with the LED flash lamps, it can turn on the laser immediately, and when the laser time is off, there will be no laser at all. So between the pulses, the laser will be totally turned off. So this also will give enough time to cool down the tissue. So this technology, we call it the DPL technology, or digital pulsed laser. So we use an LED lamp to stimulate the laser medium inside the device. So if you use a halogen lamp, the halogen lamp is not very, it's not very suitable for that part, because you will still have laser, it will be still on even between the pulses. This is an example of using DPL technology. You can see this is during the cut. There is no carbonization at all, because we have the ability to produce high energy of the laser through the DPL technology. We deliver high amount of energy in a very, very short pulses. So we have a pulse duration up to 2.5 microseconds, which is very, very short. And in these pulses, we can have also enough time for the tissue to cool down. Here is also another example of cutting, doing gingivectomy with the DPL technology. You can see that the carbonization level is almost, I can say it's almost zero, and also the prognosis after the cutting, after the treatment, is much more better. So during the cutting, you can see that we have a very, very less amount of carbonization because we deliver high amount of energy through the DPL technology with a very, very short pulse duration. Here is another case. But I want to show you a very, like I can say, a small mistake in this slide is the fiber tip. Here you can see it is like almost perpendicular onto the tissue. It is like 90 degree. So usually when you use the fiber, try to be parallel to the tissue, because if you are very perpendicular or 90 degree onto the tissue, you will deliver more energy, and this energy will cut the tissue or will increase the temperature of the tissue very fast. So you will have a high risk to burn the tissue with this kind of movement. So the best way is you have to move parallel to the tissue, not perpendicular onto the tissue. So I'm just showing you this video to show you that it is not advised to be 90 degree onto the tissue, but you have to be parallel with the gingiva. The cupping is precise and fast because then I will skip this part as it is related to the products. And finally, I will go with the clinical cases. I just want to add one point regarding using the diode laser. You can also use it to disinfect the soft palate. You can also disinfect the tonsils of the patient, and also you can remove the stones from the salivary glands or from the tonsils. You can do a tonsillectomy. You can do a tongue surface disinfection, and also you can treat the patients who complain from a hairy tongue syndrome. So the laser gives you a very wide applications. It is not only to cut the tissue or only do flap or gingivectomy. There is a lot of other applications that you can do with the soft tissue or with the diode laser. This is how you can do the pocket treatment using the diode laser. So first you have to detect the pocket depth, then you have to do the normal scaling to remove all the plaque, the calculus, or any infected debris inside the pocket. Then you have to insert your fiber at the end of the pocket without activation. So the laser should be off at that time. Once you reach the end of the pocket, you have to go back around 3 up to 5 millimeters away, and then you activate your laser, and the laser should be activated while you are going out in a spiral way. So try to move left and right so you can touch both of the tooth surface and the soft tissue surface inside the pocket. The time should be, each pocket should take around 8 seconds, and you have to wait around 5 seconds to repeat this session. So you can do it 4 times for each pocket, like each pocket like 4 times. Each time is 8 seconds, and between this session you have to wait 5 seconds because to give enough time for the tissue to cool down and also not to affect the root surface from inside. Here is how to use the diode laser to disinfect the root canals. So the best way to use is to use the 200 micrometer fiber because they have a very, very thin diameter. They can be, also they are very flexible. They can move into the curved canals. It has also the same way for the periodontal pocket treatment. You have to clean the canals, remove the pulp, do the cleaning and the shaping, and finally, before applying your restorative material, you will insert the fiber until the end of the canal, and then the laser should be totally off, and you go back a little bit, like 3 millimeter up to 0.5 millimeter away from the apex, and then you apply your laser while you are going out. Also in a spiral way, left and right, so you can make sure that you have touched all the walls of the canals from inside. Each canal should take between 5 up to 8 seconds per canal, and you can repeat this process, but you have to give enough time, like 5 seconds between each treatment, so you can give time for the tissue to cool down. The advantage of the dyed laser disinfection compared to using the normal disinfection liquids is the dyed laser disinfection gives you a disinfection range up to 1000 micrometer. But for the normal disinfection liquids, it gives you only up to 80 micrometer. So the laser can have a better and a wider disinfection range. Another point, it also have some kind of an effect on the accessory canals inside your root canal. So it can also help you to block these canals. And finally, the canal should be dry when you are applying the dyed laser, because if the canal is wet, this will prevent the absorption of, not the absorption, but it will affect the ability of the energy of dyed laser to kill the bacteria into the canal. So make sure that the canal is always dry or almost dry when you are using dyed laser. But if you are using erbium YAG or IndiYAG or CO2 into the root canal, it will not, it doesn't matter if the canal is wet or no, because you will still have high absorption when using erbium YAG or CO2 or erbium chromium. So with the dyed laser, you make sure that the root canal is dry, but with the CO2 and other hard tissue lasers, it will not matter if the canal is dry or no. In this picture, this is like a case for root canal disinfection. So it is also using the 200 micrometer fiber, as I mentioned before. Then we will go with the clinical cases. This is the last slide. Here we have the dyed laser bleaching. So I just want to clarify one point regarding which kind of bleaching material you have to use with the dyed laser. So dyed laser are absorbed mainly by the darker surface. So you have to, the best bleaching material is the red bleaching material, red hydrogen peroxide. If the red hydrogen peroxide is not available in your market, you can use the green or the blue one, because they have a better absorption for the dyed laser energy if you compare with the white hydrogen peroxide. So if you are going to do a laser bleaching, make sure that you are using a red hydrogen peroxide or a blue or a green one to have the maximum effect. You will apply your gel on the tooth and you will leave it for 10 minutes. Then you will go with the handpiece for each tooth. If the tooth is vital, it will take 30 seconds. And if the tooth is non-vital, it will take 60 seconds. So this is how to do the laser bleaching. So it is much more faster compared with the normal bleaching devices that you use in your clinic, because the maximum time for laser bleaching is around 26 minutes. But with the normal bleaching devices that you use in your clinic, actually it can take up to 45 minutes depending on your device. So with the laser, it's much more less time, and it also have a less sensitivity or less discomfort after the treatment if you can compare it with the normal bleaching devices, because dyed laser has also an effect to treat the hypersensitive tooth. So while you are doing the bleaching, you are also have some kind of an effect on the hypersensitive tooth. So that's why after the treatment, the patient will not complain from a discomfort or from hypersensitivity as he complained from the normal bleaching devices in the clinic. The treatment is contactless, and the glass rod is not in contact with the tooth. You can be around 2 millimeter away from the tooth. Each tooth it is vital. It will take 30 seconds, and if the teeth is non-vital, it will take 60 seconds. So in conclusion, you apply the gel on the whole tooth. You leave it for 10 minutes, and then you start to apply the laser on each tooth. This is the results after the treatment. Also another case. The power, it can be, if you are using a continuous wave, you can use between 1.5 up to 2 watt. It will be enough for to do a complete bleaching. And if you are using a pulsed mode, you can use up to 10 watt. It will be also enough to do the bleaching. Here is the case after the treatment. And in this picture, we have, in this case, we have exposing unerupted tooth for a child. And you can use the diode laser to do this process. You can see on the picture on the left, there is no bleeding at all. So the patient is not complaining from any bleeding. You don't need to do any sutures or any stitching after the treatment. The parameters can be between 1 watt up to 3 watt, depending on the color of the gingiva. So if the gingiva is very dark, you can use lower power like 1 watt. And if the gingiva is more pale in color or more fibrous, in that part, you have to increase the power. If you are using the continuous wave, you can use it up to 15 watt. If you are using a pulsed wave, you can use it up to 15 watt. So for the continuous, you can use between 1 watt up to 3 watt continuous wave. And for the pulsed mode, you can use it up to 15 watt. The application was in contact. So the handpiece was in contact with the soft tissue. The fiber was initiated, and the size was 300 micrometer or 400 micrometer. It depends on your choice. As I mentioned, if the tissue of the gingiva was more fibrous, you have to increase the power. And if it was less fibrous or more tender and full of blood or rich of blood, at that part, you can decrease the power because you will have higher absorption. And the next slide, this is the final results, which was within 8 days. So the advantage, it was you have minimum bleeding, clean field. So the dentist was able to see what he is doing. You have less or minimum bacteria, and there was no need to use to inject anesthesia. So anesthetic gel and spray was enough for this treatment. And as you can see that the results are just better than using the normal or the conventional methods. Also, there was no sutures or stitching at all in this case. Then we will go to another case, labial frenectomy. So this is the picture before the treatment. You can see here the parameters that was used was between 1 watt up to 3 watt continuously. It is similar to exposing the unerupted tooth. So it has the same parameters. You can, if the tissue is fibrous, you need to increase the power, and if the tissue is dark or rich in blood, then you need to decrease the power because you will have higher absorption. The fiber used was 300 or 400 and initiated. The fiber was in contact. Here is the result after the treatment. So the picture on the left, you can see this is during the treatment. There is no bleeding at all. There is no carbonization. The device which was used was Alexion Pico. So there is no issues at all in this case. And here is the final result on the right side. And it was within 6 days, you can reach these results. Also in this case, only anesthetic gel was used. So there was no injection at all. And also there was no need to do any sutures or any stitches. Here is another case of labial frenectomy. So also it has the same parameters compared to the last one. This is the picture before, and here is the picture after the treatment, and the final result was achieved within 6 days. Also another case for labial frenectomy. This is before, and here is after the treatment was done, and the final healing result was achieved within 6 days. Then we will go to the lingual frenectomy. So in this part, the parameters are also okay. I have a question from Dr. Christo. Okay, regarding the type of anesthesia, as I mentioned, try to use a plain anesthesia without adrenaline or without epinephrine, because diode laser depends more on the absorption of the hemoglobin. So if you use the normal anesthesia, which has a vasoconstrictor inside it, you will have loss of the hemoglobin, and then that will result in less absorption by your diode laser. So the best type of anesthetic gel or injecting anesthesia, it should be the plain anesthesia without adrenaline, without vasoconstrictor, or without epinephrine. Then we will go back to our case. This is lingual frenectomy. Here is the picture before the treatment. The fiber which was used was 300 or 400. Both of them are suitable for this application. The application was in contact, so the fiber was in contact with the tissue, but without doing any pressure, because as I mentioned, laser is a light, and if you apply pressure, simply you will do nothing. So the fiber will just be stuck into the tissue. So you try as you can to be only slightly touching the tissue, the surface from outside, not to do any pressure. The parameters, if you use a continuous wave, 1 watt up to 3 watt is enough. And if you are using a pulsed wave, then up to 25 watt also can do the job correctly. Here is the picture after the treatment. So you can see there's minimum bleeding. Almost there is no bleeding at all. No sutures. The operation field is clean, no bacteria. And the final healing result was achieved within 8 days. Finally, laser will be a very suitable option for the children, as it has a very less, it doesn't do any discomfort, and the patient satisfaction can be achieved with the laser compared to the conventional methods. Then I will go to the orthodontic applications related to diode laser. Also, you can expose unerupted teeth. So this is the picture before. Here is the picture during the treatment. You can see there is no bleeding at all. The parameters was also 1 watt up to 2.5 as a continuous wave. And if you use a pulsed wave, then you can use up to 25. The application was contact without pressure. The fiber was 300 or 400 is enough for this application. If the tissue is fibrous, then you need to increase the power. And if the tissue is rich in blood or dark in color, then in that part you can decrease the power. Here is the picture after attaching the brackets. So the advantage for using the laser by the orthodontist is the orthodontist can attach or cement the bracket at the same session. So after he exposed the tooth, he doesn't need to wait for some days until the bleeding stops, and then the patient come again to attach or cement the bracket. So also it will save time for him, because some orthodontists, they don't do the surgery. So they will ask the patient to go to an oral surgeon to expose the tooth and then come back again. So if the orthodontist is using a laser at his clinic, this will save a lot of time for him to do the treatment in one session. So once he exposed the tooth, he will be able to attach the bracket at the same session. Here is also another case of exposing unerupted tooth. So this is the picture before, and here is the picture after the treatment. You can see that there is no bleeding at all. The carbonization is minimum. There is no suture or stitching after this treatment. Also another case of exposing an erupted tooth. So here is before, during the treatment, and finally after the brackets was attached. And this is the final results after 6 days. Another case of exposing an erupted teeth. Also, the final healing result was achieved within 6 days. Then we will go to recontouring of the gingiva. So to do a recontouring, as I mentioned, you have to be parallel with the gingiva. So don't apply the fiber on 90 degree or perpendicular to the gingiva, because this will increase the risk to increase the temperature of the tissue, and you will also have high risk to burn the tissue. So try to work in parallel to the, or in a horizontal way movement to the gingiva. So, and also to move and to follow the shape of the gingiva. So don't work randomly from left to right, but try to draw the lines of the gingiva by following them. So the parameters were also 1 watt up to 3 watt is for a continuous wave, and for the pulsed wave you can use it up to 25 watt. You have a contact, the application was in contact and without pressure, of course. The fiber was initiated, it was 300 or 400, and also it has the same same way as we mentioned before. If the gingiva is more fibrous, then you increase the power, and if it is more bloody or more dark and full or rich of hemoglobin, at that part you need to decrease the power. Here are the final results after 34 days after the treatment. So first, this is the picture. Second, after 3 days, 15 days, and finally after 34 days. Here is another picture for smile design using the Alexian diode, which is 808. As you know, the 808 has a better absorption into the melanin, so it will be the best option to do the depigmentation cases. So in this case, we did a crown lengthening, we did a depigmentation of the gingiva, and finally we had a laser bleaching of the tooth. Another case too is removal of fibroma. So the parameters are also the same, 1 watt up to 3 watt in continuous wave, and up to 25 watt in the pulsed mode. The fibers were 300 up to 400. You apply with a contact and without doing any pressure. So this is the picture before, during, and here is the final result after 6 days. You can see that there is no bleeding at all. There is no need to do any stitches or any sutures. The type of anesthesia was used plain anesthesia, and it was only gel anesthesia. No need to do, no need to inject anesthesia into the tissue. Cutting the fibrosis tissue for the old patient, because most of the edentulous old patient, a lot of them complain from this kind of issues. So the parameters was also the same, 1 watt up to 3 watt. But as this part is very, this case, it has a very fibrous tissue, so I can recommend 3 watt to cut continuously to cut this fibrous tissue. Here is the picture during the treatment, and here is the final results after 10 days. So there was no need at all to do any suture or any stitches. The anesthesia was injected into the lips and into the floor of the mouth. So only infiltration, no need for a nerve block at all. Here is another case for lingual frenectomy for an adult patient. So this case actually was supposed to be done when the patient was young, but unfortunately he did it when he's an adult. So the parameters is also 1 watt, 3 watt, up to 3 watt continuously, and up to 25 watt in a pulsed mode. Here in these cases, we had to use sutures because you can see that the cut is very large, and also the patient is an adult. He's not a child, so we had to do sutures just to improve the healing. So the final healing result was achieved within 8 days. Another case for labial frenectomy. Here is before, during the treatment, and the final results are within 8 days. Then we will go to removal of the salivary gland stones. So you can also use diode laser to do that. So this is the stone in the floor, in the salivary gland in the floor of the mouth. So the power was up to 3 watt continuously, or up to 25 watt in the pulsed mode. You will use an initiated fiber in a contact without pressure. Here is the picture after the stone was removed from the salivary gland. So there was no need to do any stitches or sutures. And the anesthesia used, it was plain anesthesia injected, infiltration injection. As you can see in the video, try to work as slow as you can. So don't work very fast, so you can give enough time for your tissue to absorb the laser energy. Then we will go to another application. It's called exposing the dental implants. So here is the implant after, here is the implant inside. So this is the picture before, and this is the picture after the implant was exposed by diode laser. So the advantage of that is you don't need to do a flap surgery to expose the implant. So you just do a small opening around the implant, and then you will attach or connect your gingival former or your healing abutment. This also will give more support to the prognosis and to the healing around the gingival former, because when you expose the implant using the conventional method, like to open with a scalpel and then do suturing, that will give long time for the healing to happen. But with the laser, you just make a small opening around the implant, so that also will help the gingiva to form correctly around the healing abutment. So the final results are also achieved within 6 days. Here is another case. So this is before exposing the implant, during the exposure, and this is the picture after the exposure was done. So you can see there is no bleeding. You can attach your healing abutment immediately, and the healing will happen very fast, maximum within 6 days. Another point is the diode laser can be used both on the soft tissue side and also on the implant side. So diode laser can help you treat the patient who have a peri-implantitis. It will be also very beneficial for that. So you can use the diode on the threads of the implant to clean it and remove any infected tissue around it. Here is a case of recontouring and depigmentation of the gingiva. So here is before. During the treatment, the parameters as shown, it was up to 2.5 watt continuously, or up to 25 watt if you use the pulsed mode. The fibers was 400 and 600 in initiation, and the distance, it was a contact. The laser was in contact with the tissue without pressure. Here is the final result after 6 days. In this case, the anesthesia was topical anesthesia. gel on the gingiva, so there was no need to inject anesthesia at all.
NATO members stepping up, meeting their commitments to what they're supposed to do. You'll say, if things slide back, then who knows?
Here another case of recontouring and depigmentation of the gingiva. So this is the picture before. During the treatment, you can see there is no carbonization at all. And the laser was used, it was 808 because it has a better absorption into the melanin. And this is the final result after 6 days. Another case of depigmentation of the gingiva. This is the picture before. And this is the picture after the treatment. This is depigmentation also. So here is before, during the treatment, and after the treatment, the results were done within 6 days. So we have already spoke about a lot of depigmentation. So I will skip the depigmentation cases. So there is a question about the fibers, the difference between the initiated and non-initiated fibers. So initiated fibers means that the fiber is going to cut the tissue. Non-initiated or uninitiated fibers doesn't have the ability to cut the tissue, but it will only disinfect the surface. So that's the difference between the initiated and non-initiated. To do the initiation, you have to use a very dark surface. I can recommend the eye mascara, which is because they have a very, very dark surface to do the initiation very fast. I don't recommend using the articulating papers that you have in your clinic because they are not dark enough to do the initiation process. Plus, they also will, sometimes they burn, so they can do some smoke or something. So the eye mascara are the best way to do the initiation. So you apply the laser on it for up to 5 seconds, not continuously. So you just apply the laser and go back and go in and out until the end of the fiber is totally initiated. So that's the difference between initiated and non-initiated fiber. So I will skip these cases because we already discussed it. Okay, then we go to the depigmentation of the lips. So this case can be done by a diode laser, but actually it is like a very sensitive application. So the dentist has to know exactly the parameters, the physics, and the interactions between the diode laser and the tissue. So because you are doing the externally, so I don't recommend to do this treatment if the patient, if the dentist doesn't have enough knowledge about laser physics and the laser interaction with the tissue. So here is the picture before the treatment, during the treatment, and after the treatment. So of the handpiece was used, it was using the fibers 600 micrometer together with the glass rod. So also the finer healing, it was achieved within 6 months. Light discomfort after this treatment because he will feel some kind of burns in his lips. So this can be will be gone within 4 or up to 6 hours after the treatment. So that's totally normal. Then we go to the low-level laser therapy. Here, you can also use the laser to stop the bleeding after the treatment. So in this case, the dentist cuts the frenum and laser to stop the bleeding. So this is also another way. So some dentists, they prefer to cut the frenum using the laser. Other dentists, they prefer to use the scalpel and then they apply the laser to stop the bleeding. So it depends on your choice. Also, you can use the diode laser to stop the bleeding after extraction. So in this, in there, you don't want to cut, you just want to disinfect the area and stop the bleeding. So a non-initiated fiber can do the job. Here is after the extraction. You can see that the socket is blocked through the coagulated blood. And the coagulated blood also will help the socket to close in a faster way, and the final healing can be achieved within 8 days. Also, you can use the low-level laser therapy after the flap surgery to improve the production of the ATP and improve the function of the mitochondria, which will, at the end, will result in a better prognosis and a better healing, because it will eliminate the availability of the nitric oxide, of the nitric oxide inside the tissue, and that will improve the healing process. You can apply it up from 0.5 up to 2 watts continuously, and the time for this kind of application, I can say at least 2 minutes will be enough for low-level laser therapy to have to do the biomodulation. So if the time is more than two minutes, it will not be a problem. But make sure that you apply the laser at least for 2 minutes, so you can give enough time for the tissue to absorb the energy. Here you can also use the low-level laser therapy to treat the aphthous ulcer. The treatment, the parameters can be from 0.5 up to 2 watts. The application should be contactless. You cannot, you don't need to be in contact with the aphthous. So you have to be around 4 millimeter up to 6 millimeters away from the aphthous, and you can apply the laser up to 5 minutes onto the on the ulcer. And for this treatment, make sure that the patient can feel the heat. So here you don't need to inject anesthesia at all. You just apply the laser, and if the patient can feel severe heat or severe pain, try to go away or to be a little bit far from the ulcer. So, but make sure that the patient can feel the heat all of the time. So like an accepted heat, not the painful heat, but he should feel an increase of the temperature, because if the patient is not feeling any heat at all, that means that your application is not going to be successful. Here is the final result after 2 days. So the patient will, the pain will be gone immediately after the treatment, but the ulcer itself, it will relieve within 2 days. Here is also another case of to treat the abscess ulcer. Then finally, you can use the diode laser for retraction of the gingiva to do a gingival troughing, so you can take your impression. So in this treatment, you don't need to do to attach retraction cords. You can use the laser to retract the gingiva. So you insert the fiber. I can recommend the 300 micrometer fiber. It will be enough for this job. So you insert it with a beveled way into the gingiva, between the gingiva and the end of the crown, and you apply it slowly. You don't need to cut, but you only need to do shrinkage of the tissue. So it is like, I can say it's like a very, very small cutting into the gingiva. So, and with that, because of the heat of the laser will cause also shrinkage of the gingiva, so the gingiva will be elevated, and then you will be able to take your impression correctly. So here is the picture during the treatment, after the impression was taken, and here is the final results. Also, another point, you can use the diode laser if you have an intraoral scanner at your clinic. Diode laser can be a very good option to dry the tooth before taking your picture. So you apply the diode laser on the finish line, on the whole tooth, and then until the tooth is totally dry, and then you can take your and you can scan your tooth very easily and very fast. Here is low-level laser therapy to treat the herpes. So before, after, and finally, the last slide, treating the patients who complain from snore. And as I mentioned before, the best wavelengths to treat snoring, it will be the 808, because it has better ability to improve the collagen production into the soft, which can treat that. It's called the Claros Snore 3. So this device actually has, it comes with around 70 dental applications. All these applications are preset, plus you have also a customized mode to control the power, the frequency, the pulse duration, plus it comes with a software, it's called Snore 3. And Snore 3 is available in Genoa University Research Center. So they are doing a lot of researches about treating the patients who complain from snore. The snoring can be treated, the type of snoring of the patient which can be treated is because of the soft palate. So snoring, some of them are because of the vocal cords, some of them because of the soft palate. Other reasons are because of the patient has some problems in the maxillary sinus. Then finally, with the treat only or for other reasons, diode laser is not going to do that. We can from problems in his soft palate. 3 up to 5 sessions. Each session will take up to 25 minutes, 6 weeks, and then the again. So we'll leave again after 6 weeks for the third session. Why do we need 6 weeks between the sessions? Because this is the required time for the collagen production to be fully produced by your tissue. So usually the collagen production will happen between 4 up to 6 weeks. So we leave 6 weeks so we can make sure that the collagen was completely produced in your tissue. Here is the second session, third session after 6 weeks. So some cases to 5 sessions, but most of the time the patient will only need 3 sessions. Here is the final case. So this is before the treatment, first session, second session, and finally third session. And I think this case needs also 2 more sessions so you can get the final results. Thank you so much. I'm sorry if